How that little ditty
That
tune?
was great.
It's fun, isn't it?
Yeah.
I just wanted welcome everybody. It's a unique day. Usually we only have things scheduled on Mondays and Tuesdays, and today I'm excited that we're doing a little interview with Marina, and Marina's going to share more with us, or going to share with us, period, about linguistics or your voice and how to care
Voice.
for it and protect it. So, without any further ado, Marina, welcome to Gig Jig.
Thank you. I'm
And
so happy to be here.
well, and I'm thrilled to have you here too. So this is going to be fun. So the reason I wanted to bring you on is because I noticed that you'd posted something the other day, and I just thought there's so many people in this group, if not everybody, that can benefit
Mhm.
from what you have to teach, because more and more we're having to express ourselves vocally, verbally, in person, or just audio, whether you're a podcaster or you're doing presentations. So let's just talk a little bit about what are the common issues that people have, or like I'll even give you an example. For me, as I
Mm.
start to talk, I just feel like I'm getting tighter and tighter here, and it's just like there's this stranglehold on my vocal cords, and then I start to get croaky. So what's that?
I am so glad you asked that question because actually that is the most common thing that happens to us when we're a little bit nervous or when we're in a situation where sometimes we're about to enter a situation that we don't really realize consciously that we're nervous about. We don't even expect that to happen. And then all of a sudden we're like, and when we're finished talking, or if we have to do a speech at work or whatever we might be doing, it's like, what is happening to my, like, what happened there? Now my voice is back. Why did my voice change just for that little bit of time? And, was it in my head? Did it sound like that to everyone else? Because it felt that way to me.
Yeah.
So it does change, especially with stress. And what happens is we really change physiologically, not just our vocal cords. And when I show you some of my slides and you can see the anatomy, and I'd like to show how our voice is supposed to work in combination with our breathing and the rest of our anatomy, because the actual physiology and the anatomy actually moves when we get nervous, and other muscles tense, including, all of the many muscles in our neck, the muscles in our back. And in the end, what ends up changing our voice is, in the end, our hyoid bone and our larynx elevate. So our larynx and hyoid bone are attached to each other. They're right next
Yeah.
to each other. And when they elevate, we actually have more of a narrowing space in our throat.
Makes
So it
sense.
changes the way that our voice sounds. So it actually, and that's kind of similar to when singers go to sing and they're inappropriately stretching their neck out and trying to hit that note, and they're not hitting it because they're actually changing the capability of what their vocal range can really do.
Right, their
So,
posture's changing so much that they're not
right,
able to reach those higher points.
right,
Wow, that's really
right.
interesting.
So when you're changing your posture on top of being nervous or tense or stressed, everything changes. So it's like a double whammy.
Right.
So I think for any change to happen, like with anything in life, if we know what's normal, then we can recognize and be more aware of what we're doing that makes it more abnormal so that we can fix the problem.
Pretty neat. Okay. So is this a good time for you to just jump into your slides? Would you like to
Yeah.
do that?
Yeah. Why don't
Okay,
we do
let's
that?
do that. You
Okay.
are
So
in control.
I do have at the top there my email address, by the way, which I think at the very end I have there as well. So my website and my email address are right there. The MS is Master of Science, CCCSLP. So I'm a licensed speech language pathologist. That's what that all stands for. The C's are an extra 9 months after grad school, and we have to put that after our name. So just in case you're wondering what all that is. So a healthy voice is really important to keep it healthy. Our vocal cords are so tender. They're so tender, but they're actually more than what we see. We always see the V in our throat that comes together, but the anatomy of them, it's actually multiple layers that are there, which is really great because to heal, sometimes it doesn't take very long once we've abused our voice, or if we've used it in the wrong way. And I will get to that part, but I just like to tell people how tender they are, because we have to take care of them. And the best thing we can do is prevent damage, because once we have damage, there is treatment. There is a lot of therapy out there. That's what keeps us therapists busy. But there is a lot we can do to prevent it. And I, especially for one, doing a podcast and having many colleagues doing it, podcasting is so big now, and just coaching on Zoom or whatever avenue we use our voices for everything. When you think about it, teachers and coaches and clergy, and all of us, we use our voices all the time. So just keep in mind, it's important to protect that voice of ours, as well as knowing how to fix it when we have damaged it, because we do it on occasion in a loud room. There's lots of different things we can do to damage our voice. So how does it work? So this is kind of obvious for people, but when air enters our lungs, it actually enters through our trachea. So these rings that we feel in the front of our throat, and our lungs begin to expand. And when that happens, our ribs actually move. Our ribs move out, and our diaphragm descends. And then when we speak, or when we exhale, the air reverses and comes up through our larynx, and it travels right through our vocal tract. So I'm using my hands, and you can't see me with my microphone, but it comes up through our vocal tract. And that's when the vocal folds close and we make sound. That sound is modified based on the position of our articulators, which is our tongue, our lips, our cheeks, and that's how we actually produce sound. So this is our anatomy here. Now, if I move my cursor, can you see that? If I move my arrow on the computer, or no? No?
Are you moving it right now?
Yeah.
No, I'm not seeing it.
Okay. That's okay. So I guess I'll just direct you to where you see left true vocal fold on the right side of the screen. There's an arrow pointing. So that V shape that you see, those are actually the vocal cords or vocal folds. They both mean the same exact thing. The epiglottis that you see there is kind of like a leaf-shaped flap. If you actually see it flap over and move, it's kind of shaped like a big leaf. So the job of the vocal cords when speaking are to come together when we're voicing. And the epiglottis actually it flaps over when we swallow, and the vocal cords also close when we swallow. So the vocal cords have two jobs: moving when we talk, when we breathe, and closing to protect our airway, because if anything goes down into that trachea, where you see the arrow pointing to the trach, that's the airway. That's the airway, the windpipe, the trachea, all means the same thing. And that's where only the air is supposed to go.
Well, this is interesting. I didn't realize that there's actually, and I've got an anatomy
Mhm.
physiology background. I
Mhm.
didn't realize that there's 2 levels of closing off your trachea.
Yes.
Well, that's really interesting.
So the epiglottis, it does not close off and move when we talk. It's just when we're swallowing. So
Right.
it's supposed to just sort of stay at rest when we're speaking. So, and we really don't need to know the aryepiglottic fold and all that stuff. That's the function of all of that. Is it does come into play with swallowing. And when I do swallowing exams, this is the view I see when I go in the nose, and I have like a bird's eye view of the entire throat, and that's what I see. So this is actually a photo that I have from shots from that particular view. Let's see, am I missing? Yep. Okay, so that's good. Oh, I do want to tell you too, one of the reasons why people have a change in their voice is because of reflux. So we call it, when it comes up this far, up to the level of the vocal cords, it's called LPR, which is called laryngeal pharyngeal reflux. That means that the reflux material is coming all the way up to the vocal cords and causing damage. So where you see it labeled right arytenoid cartilage and the aryepiglottic fold, all that tissue gets very red when we have reflux.
Okay.
So we can see that. We can see evidence of reflux if we don't see it actually happening in real time when we evaluate people, just from seeing the color, the swelling and the redness. Now, I kind of think this happened for a reason. I had LPR for a long time. And one of the symptoms of laryngeal pharyngeal reflux is continuous throat clearing, having that hoarse voice. And during a time of my life where I was very stressed, that was kind of the outcome of my stress is I had this reflux happening, and it was very red, it was very swollen, and I did go to an ENT. And that's you really need to be properly diagnosed by an ENT if you feel like you have those symptoms. I do see it myself, like when I do, like I said, when I do swallowing exams, because some people aspirate material that comes up that far. It comes up and they're not clearing their throat to protect their airway, they're aspirating. Okay, next slide. So we talked about the hoarseness, and also people have that strain, that raspy voice. All of that, all of those changes in the voice are used, really come down to one term, which is dysphonia. And dysphonia really just means a change in our voice. We just don't have that normal, clean voice that we used to have. So all of those symptoms are very similar for some people. If you have hoarseness, you often have that raspiness. So people just kind of use their own terms to describe what's going on with their voice. A lot of the reasons for these symptoms are the things that I have listed here, which is voice fatigue, vocal tension, vocal abuse, and then something called muscle tension dysphonia. You can actually have all of these going on, or you could have one of these things going on. So this again, now for the sake of the time that we have here, I'm going to have to kind of summarize what's some of the symptoms that we have and the way that we can describe the changes in our voices. But depending on what you might be experiencing, the treatment will be, the treatment is basically geared toward what each individual person is experiencing. So for example, if you're talking all day, I know for myself, I'm a speech pathologist. I see patients all day long. At about 8 o'clock at night, I have a lot of vocal fatigue. I don't want to talk. And I also know, I can see my voice in my head. I can see what my vocal cords are probably looking like. And I really want to make sure that I don't talk anymore and I don't continue to push my voice. So I have a lot of vocal fatigue by the end of my work day. Some people experience a lot of vocal tension. The vocal tension often goes along with the muscle tension dysphonia, which I will get to. And then the vocal abuse is people that are just not using their voice properly, not sitting and positioning themselves the way they should, or if they're standing. So that leads me to going back to the breath when I described the breathing. If we're sitting and our posture is good, and we're standing and talking and our posture is good, we're actually using 184 muscles to properly and optimally use our voice. So if we're not sitting and having good posture when we're doing our podcast or talking and coaching and whatever it is we're doing, we're not using and taking advantage of all of the muscles we've been given to project our voice. So if we're not using all of the muscles, then we're overusing the muscles that we have. And that snowballs quite often into more muscle tension in those poor little muscles that were only designed to be used a certain amount. Does that make sense?
Yeah, that makes perfect sense. Just like with any muscle group in the body, if you're not don't have the right posture, you can
Right.
be imbalanced. So that's basically what you're getting to, is that you're imbalanced because
Exactly.
you're not using it right. Makes perfect sense.
Right. And some people too also speak when they get tense, they have their shoulders up, so now their shoulders are tense. And when your shoulders are tense, your neck is tense. And
Yeah.
there are so many, I won't get into all the anatomy of the neck, but there's a lot of musculature in here. So when you're doing this, then you're changing your breathing because you're using accessory breathing. So when you think about all these other things that are supposed to be aligned, that's how really it doesn't come down to what's going on with our vocal cords, because we're doing all of this other stuff improperly.
Wow.
So yeah, I know people, I think, I don't think about it too much because I've been doing this for 34 years. And I always think, well, people probably know this. But then when I talk to people, you know, I don't think people think about the things that each of us specialize in. I think it's important to share. And I think that's what a lot of us are doing now that we're all finding our niche, we're finding what we know and we're sharing it with the world. And now we're all using our voices. So
Yeah.
my goal is to be able to really help people to use their voices and use it properly, because nothing would pain me more, and I really, really mean this, than to meet somebody who has something to give and something to share. And we all do. Every single one of us do. And to have us come against some kind of a brick wall because of the sound of our voice. We can change the way our voice sounds. I have friends that I know very well who have very, very harsh, misused voices. But I know in my heart that they don't have vocal nodules. They don't have polyps on their vocal cords. That's all been ruled out. It's just they're using their voice the wrong way.
Right.
And there are ways to use it. And you can change your entire life if you just kind of step out of that little doubt pool, and just say, okay, there's got to be something out there. And there is. So I like to share this. And I want to say to anybody else listening to this, that if you know someone, and I can't imagine, I think when you hear this, you sometimes maybe think of somebody or a relative or a friend of a friend. Yeah, I remember that person 10 years, this person I met in college. Yeah, she had a really, really rough voice. Not the soft, sexy Demi Moore voice, but a really, a voice that might embarrass someone or might limit them from really, really doing what they love to do and really making a difference.
Yeah.
All right, I'll get off that little soapbox. There are many, many causes of what we may be hearing and what we may be feeling in our voice. So I can't stress enough to go to an ENT first. And if somebody comes to me, I'll even say to them, I always speak to people and do like a free first, like 15, 20-minute little intake type of thing. But my very first recommendation is go see an ENT and make sure there is no acute injury. Make sure there is no like pathology there, like vocal nodules. Because if there is, then that would change my course of treatment.
Of course it would. Yeah.
Keep it in the microphone. There's treatment for vocal nodules and there's treatment for muscle tension dysphonia. There's a different approach for everything. So it's very, very important. And I won't do it. I mean, ethically, I won't see anyone for treatment until they've been seen by an ENT.
Perfect. Is it too early for questions?
No.
Okay, great. Well, one thing I just wanted to say, and hopefully everyone does know, but in case you're wondering what an ENT, that's an ear, nose, and
Oh,
throat
yeah.
doctor, someone that specializes in ear, nose, and throat, because they're so intertwined.
Yes.
We've got a question here, though, that I wanted to share with you. Someone's saying that their voice gets weak fast due to bronchitis and secondhand smoke.
Mm.
Is there anything? Well, first of all, get away from the secondhand smoke.
Yes.
But
Please get away from that.
yes.
There is. I can't tell you what the smoke does to the voice. It's very damaging. It's just as bad as smoking. So you just have to stay away from it. It's so important. If you have damage, let's say you're no longer near that secondhand smoke, but you feel that you have damage you're dealing with because of it, yes, there is something you can do. The first thing I would say, again, is to be seen by an ENT. I have a friend and her brother, actually, I could hear from the smoke in his throat, I could hear the change in his voice. And it was very, very rough, very guttural. And he went to the ENT, gosh, probably about a year and a half or 2 years after I begged her to send him to an ENT, ear, nose, throat, otolaryngologist, same thing. And he ended up with throat cancer.
Oh,
And it was really bad throat cancer. He ended up having to have he had a laryngectomy. So the entire larynx was removed. and he had to have his esophagus had to be stretched and basically just brought up right to the back of his throat. His quality of life was just completely changed, and he ended up passing away.
Oh, that's so
So,
sad.
that's one story, and I know there's people that smoke, and there's people that are around secondhand smoke, and I'm not saying that's going to happen. I just share these stories only because I feel like I feel that sometimes people that are around secondhand smoke don't realize I've got to put up a boundary here. Either this person smokes outside if you live with them, or I have to get away. I can't be around this. Um, the damage after the fact is there's a lot you can do. If the ENT sees you and he says, yeah, there's a little inflammation, but you're okay, there's nothing concerning here. There are a few things we should do to be able to, even with vocal strain, same thing, moistening, making sure our throat is very lubricated, drinking a lot of water. But beyond that, when we swallow, I don't know if you remember me saying our vocal cords have to be closed. The epiglottis comes over the vocal cords. So now when we drink, it's not hitting our vocal cords. Hopefully not. If it is, it's penetrating in an area that it shouldn't be. And that's because it leaves room for it all to go down. It all closes so everything can go down the esophagus. I highly recommend steamers. There's a company called Mabus. The Mabus steamer is wonderful. They sell it for like $26.99 on Amazon. And it just allows you to you can put it over your face, or even a pot of hot water, and just like put a towel over your head and just breathe in the steam, because that moist air is hitting your vocal cords, because now your cords are open. So as you breathe in, the air, that moist air is going in and out. Wow, it's really windy here. I don't know if that's picking up, but it's like really windy. We're gonna have a huge storm. It's moistening your vocal cords, and really it's like medicine for your vocal cords. Honey, drinking warm tea, all the things that you hear about. Also, for a sore throat, whether it's from smoke or from vocal abuse, having throat lozenges that have glycerin or pectin is important. Ricola is one of them. It's a great brand. The other ones can dry out your vocal cords more. So sometimes, I don't know, a lot of people just go and grab, whatever they can, not thinking about what's actually causing more dryness. So I thought I'd just throw that in there. But
That's actually
yeah,
quite fascinating. So,
yeah,
um, r Ricola. That's
Ricola, yeah.
yeah, I can't think of it without hearing the guy sing. Um, that's perfect, and that's pectin, and what was the other?
You want throat lozenges with pectin and glycerin.
And glycerin. Interesting.
Yes. And I recommend that, really, I mean, outside of what we're talking about, even if I just, had a cold and a sore throat or upper respiratory infection, which that all of that changes our voice. Our vocal cords get very moist, get mucousy. So those types of throat lozenges actually I recommend that. Most speech pathologists that look into all that, yeah, that's what we say. The other stuff dries us out. And you can Google it. You can just say throat lozenges with glycerin, throat lozenges with pectin. There are a few different brands, and
Right,
they'll pop
perfect.
right up. Are there any more questions in there before I go on?
That's it right now, just it was Yvonne that sent that message, and,
Okay.
she was just saying that, her mom was a smoker, and she lived with her for 21 years,
Mm,
but that was 35 years ago, and she
mhm.
has seen an ENT. So,
She has seen, okay,
yeah,
great.
good first
And
steps.
everything's good, right? Everything's clear, I
Yeah, is
hope.
everything good, Yvonne? You let us know.
Now, I
Okay.
just wanna, I have a couple notes here too, that I just things that I was so afraid I would forget as I talk about the vocal cords, and I thought of something, that's why I wanted to look over here. But about the mucus, yes. Um, the vocal cords, now I have to see if let me just pop up to a slide up here. Okay. So our vocal cords have 3 layers also. So when we're actually slamming our cords together by misuse, too loud, clearing our throat all of the time, we're actually having that outer layer that's hitting each other that can be damaged. So what's on a good note, what's being preserved are the other layers. They're protected. But when we have that like upper respiratory infection, let's say, or a cold, and we're always clearing our throat, and we have that postnasal drip, when we clear our throat, we're actually often causing more mucus. And then it's kind of like a vicious cycle, because then we get pink and we get swollen, and then we want to clear our throat again, and that causes more mucus. And then we're clearing our throat because of the mucus. So it's just over and over and over again. So I do have a slide on here actually to recommend the whole throat clearing thing, and what to do to try to minimize the throat clearing. But whether we're sick with a cold or have that reflux, which is very, very common, I think it's like 50% of American adults have esophageal reflux. And a large percentage of people have it and don't even know they have it, because it's like a silent reflux. We don't necessarily have that burning. So some of us are more at risk when we have that to having it come up to the level of our larynx. Just wanted to throw that out there. When we do go to an ENT, make sure that this ear, nose, and throat doctor specializes in voice, because some specialize in ears, some specialize in the nose, some specialize in the throat, some know it all, but make sure that they specialize in the voice. That's important. The doctor will look at the structures, the muscles, and the function of your voice. And they will look at the structural, just the anatomy, and to make sure how everything is actually presenting as opposed to moving. And they'll also look at neurological, rule out any neurological concerns, because that actually changes with different neurological diseases like Parkinson's and myasthenia gravis, MS. There's a lot of different neurological diseases out there that can affect the throat, ALS. So what they do is they look at many different parameters. They want to make sure that they use the video endoscopy. They do air pressure flow tests. There's lots of different things that they do. It's not painful. They go in with an endoscope or a video strobe, and they look at your throat. They've got great equipment now, and they can basically see everything in a very, very short, like a few minutes. They can pretty much pick out what's happening. So stop clearing your throat. This gets to the throat clearing. So the first thing to do, and I can definitely speak to this. This I experienced myself. And these recommendations are not just coming from me. This is from many speech pathologists and studies that have been done. First thing to do is be aware of how often you clear your throat. I swear, when I went to the ENT and I kept complaining, I went there because my throat was sore. And I wanted her to look, and I'm thinking, and here I am, a speech therapist, and I'm like, oh my gosh, I have cancer. So I went, and she went to go put the endoscope in my nose, and I'm smirking because I do this exam, right? So I'm like, okay, she's like, would you stop it? So I said, well, I just, I haven't had it done to me, in a really long time. So she went in, and she was fantastic. She got in literally 5 seconds. I kept my head back, and she looked. So she said to me, so you told me earlier you don't clear your throat. And I'm going, no. And I kept clear. No, I don't. How often do you think? She goes, I think you do clear your throat. Are you aware of how often you clear your throat? And I said, I don't clear my throat. And she said, you've cleared your throat 12 times just in the few minutes that you've been in this room, and I didn't even start your exam yet. So I needed to be aware. When she said that, I became aware of it. And of course, there were times when I'd be talking to someone, and I realized in order to keep talking, I had to clear my throat. If I didn't clear it, I wouldn't have had a voice. But what was happening was my saliva, my secretions were coming up my esophagus, hitting my vocal cords, and I had to clear my throat so I could speak. So Number one, monitor your throat clearing. Count the number of times that you clear your throat just for your own self awareness. And then do the other things I was talking about, like increasing your hydration, using the steamer, the boiling water, the Mabus machine, and then substitute your clearing. Try to substitute it with a sip of water. So when you actually feel like you have to clear your throat, take a drink because you're actually going to move some of those secretions that are right there that need to be cleared. You're going to move them down your esophagus and you're going to start getting away from the sensation that you have to clear your throat all of the time.
Do you see me practicing? I
Are you
just
doing that?
as
I
you're
can hardly
talking
see
about
you,
it,
but
I'm a terrible throat clearer. In fact, I will never forget when I was coaching in Italy. I was coaching with a girlfriend, and one night she got so fed up, "Would you just shut up with clearing your throat?" And I didn't realize how often I was doing it. But I think I was stressed. I'd just flown out
yeah,
there. We were just started, and yeah, I'm
yeah,
a massive throat clearer. So I've got my water here. So I'm trying
good,
to be aware of that and swallow instead of clear.
good,
Yeah,
perfect.
I'll put you back
Thanks
on.
for sharing that. See, I'm not alone. So if you do have to clear, gently clear your throat if you absolutely have to. And then you want to consult an ENT again and make sure that you do not need some type of medication. By the way, if you do have laryngeal pharyngeal reflux, which you'll see LPR there, um, it's important to go on like a what they call a proton pump inhibitor. So that would be like Nexium. The other name for it is omeprazole, pantoprazole, lansoprazole, all the prazoles. Those are proton pump inhibitors, and they keep that down. They keep it at bay. A lot of times, people who are not much older just stay on it for a therapeutic period of time. So a lot of times, people stay on it for like 6 to 8 months, and then they try to pull back a little bit and take a little bit less. I do want to say, and this is just another, I am a research geek and people always call me Cliff Clavin as a joke, but or when I bring all this stuff up and did you know, blah, blah, blah. But if you have laryngeal pharyngeal reflux, 40 milligrams, and I say this, I can't stress this enough, 40 milligrams is necessary, not 20. So if you're on Nexium and the doc says, well, we'll just start you with 20, the insurance companies are willing to cover 20. And sometimes we have to push for the insurance companies to cover the 40. So sometimes doctors like to write a prescription for 20 instead of 40. But I do want to tell you, and when I do exams on my patients, I'll always write, I don't tell the doctor what to do. I'm very careful, but I do say that I saw backflow and I'm suspecting that it's laryngeal pharyngeal reflux. MD to please consider 40 milligrams of proton pump inhibitor. And they're usually willing to do that. So just giving you something to support yourself if you end up at the doc with something like that. So some fast ways to get rid of voice hoarseness and voice fatigue fast and effectively. Is there a way to move our, I just can't see my slide because, oh, thanks. Okay. So the three things there, we have proper hydration, vocal rest, and choosing our meds wisely. So the hydration, I think I went over enough. I do want to say that when we do have the steam and the humid air, it does help the voice by healing it dilates the blood vessels, and that's why it's so healing to the vocal folds. So it thins the mucus right on the vocal folds. Vocal rest, this is challenging. Every sound you make, the superficial layers get broken or damaged, even if you whisper. Please don't whisper. If you have a voice that has been damaged, it's important to not talk at all versus whispering, because you've got all these edges of your vocal cords that are still coming together. You still have sound coming through, and you have your vocal folds still being required to close. And choosing your meds wisely. Aspirin and ibuprofen reduce swelling and pain, but they can have adverse effects. Decongestants have a drying effect, and this is where I mentioned the lozenges and the throat sprays. They can also dry you up. So choose those lozenges with the pectin and glycerin. I don't know if everyone will be able to get a copy of these slides, but I can always send you this information too if you email me and you
Yeah,
want.
we can post it up in the files. That'd be
Oh,
great.
great,
Yeah,
great.
thanks.
Okay, let's get to the good stuff. So muscle tension dysphonia. Dysphonia, period, is an abnormal change in your voice. So your voice may sound hoarse or raspy. You may have pain, tension, effortful speaking. And look at these carefully because you may just have one of these. You don't have to have all of these. Breathiness in your voice, a decreased vocal range, and globus sensation. Globus sensation is like feeling like you have a lump in your throat, unusual pitch, weak voice, or no voice at all. So it can't bed different. It can be different for everyone. I don't know why those were. I think I was trying to fit everything into my little bubble there. So any of these things are dysphonia, any of them. So dysphonia can be caused by stress and anxiety, just emotional trauma, a traumatic event, acid reflux, glottal insufficiency. So the space between the vocal cords, and get in front of my camera, the space between the vocal folds here, that's the glottis. The entrance to the trachea is the glottis. So glottal insufficiency would mean maybe your vocal cords don't close all the way, or that part of the anatomy is insufficient. It's not working like it's supposed to. Muscle discoordination, allergies, irritants, and for a lot of us that are watching, increased vocal demand. You know, I think about too, we go live all the time. A lot of us are trying really, really hard to get ourselves to do that and take that step to go live. And even in those moments, we're trying to talk and get everything in so we're not live for too long. If we're doing like a short clip, then our nerves get in the way because we're going live. So a lot can happen, you know, when we're using our voice. And then when we're doing all of these side gigs too, in addition to working all day, now we're using our voice at night. And a lot of us are trying to get out of this, you know, quit our day job thing. So we're doing, you know, we're working twice. We're working nonstop.
Absolutely. I thought just as you were speaking, I'd go full screen.
Oh,
Um, yeah, we all are putting a lot of pressure on our voice, and we just don't
we
realize
are.
it. So I'm so glad that you're bringing this up because
Yes.
we just
Oh gosh, there goes my phone.
oh, that's okay. That's okay. We're human, right?
Yeah.
These things happen. But yeah, it's fascinating as you're going through this because there's so much that we don't realize that we can
Yeah.
have control over. So
Right,
I'll
right.
I'll let you go back.
Okay, thank you. Let's see. Okay, next slide. So muscle tension dysphonia. This is a diagnosis of exclusion. So we need to make sure that nothing else is happening. There's a range of vocal qualities and severities. Episodes of normal voice are very characteristic. So what I mean by that is non-speech sounds like throat clearing, laughing, giggling. So someone who has that muscle tension dysphonia actually is speaking with very tense, high laryngeal placement, and their voice has changed. There's nothing on the cords, there's nothing on the vocal cords causing it to sound that way. And when they giggle or when they laugh or clear their throat, all of a sudden you can hear this normal little glimmers of this normal voice. And it's very important to address other contributing factors like any lesions, any medication, emotional stress, the anatomy, which is going to be seen by an ENT, and lifestyle. Now, you can have muscle tension dysphonia while you have other, for example, you know, you can have vocal nodules and still have muscle tension dysphonia. You can have laryngeal reflux occurring and still have muscle tension dysphonia. So there is not a quick fix for it, but reduced muscle tension is the very first thing we would start working on. You want to release the tension. There's manual release, and there's mindfulness also. A lot of times It's from, like, I bring up stress a lot. A lot of times it starts with that. And that's why we change our posture a lot of times when we're communicating. The other thing is we want to improve vocal efficiency by relearning and developing vocal patterns without any tension. And there are also vocal endurance and strengthening exercises. I'm going to back up here because I just want to tell you, without the muscle tension, say for example, you're somebody, like we were saying, that gets very tense when you're talking, or has that vocal, you have that vocal fatigue and your voice changes, or you've got this change in your voice that just won't go away. It's not like it's better the next day and you go to work all day and it's only at night. So you've kind of narrowed it down to vocal fatigue. We also need to be able to warm up our voices properly. There are vocal warm-ups we can do. There are vocal exercises we can do at the end of our day to heal our voice and make our voice feel, and it's wonderful because it's kind of like meditating, you know. It just makes us have to stop what we're doing. Taking care of our voice is relaxing. So it's important to do that and not wait for some kind of a major diagnosis. I think when we all have high vocally demanding jobs, it's important for us to warm up our voices, use our voices properly, and cool down, if you will, our voices at the end of the day.
So are you going to give us a little example, a little taster of what that is?
I can give you, okay, so I can give you a really good relaxing vocal warm up. Now that you sort of know the anatomy, about the anatomy with our breathing and about how our vocal cords come together and how the air comes up and how the air comes back in when we're breathing. So if you think about this as the glottis, so these are the vocal cords, this is the glottis. Subglottally, so below the glottis, our air comes up, and then above our glottis, the air goes down. So what we can do is called a vocal exercise where we're going to balance the subglottal pressure compared to the pressure that's going this way. So you're kind of like neutralizing the pressure above and below the vocal cords.
Okay, this sounds interesting.
All right. So you have your straw.
Okay, I'm going to put us full
Your water.
screen. Okay, I don't have a straw. Can I drink straight out of this?
Well, this is actually a straw exercise.
Oh, it is a straw. Okay,
yes.
Well, you demonstrate and then I'll get a straw later.
So this is an example of a semi-occluded vocal tract exercise. This is kind of one of my freebies that I put out there for people. So there are many levels of it. You can actually just use a straw and hum through the straw, but I like to do it. You eventually build up. The example I'll do with you is with the bubbles. You're actually going to put it in a cup of water.
Yeah.
And when I go to blow, I'm going to hum. And as I hum and blow the bubbles, I'm actually changing the pressure above and below my vocal cords.
Oh.
Okay. So it's kind of like this. Can't believe you're making me do this.
So when I teach kids how to swim, I teach them how to do that so that they're blowing out their nose and through their mouth and making bubbles and humming so that they don't suck up any air. So
right. It's kind of the same thing.
Yeah.
It's kind of like a vocal warm up, but there are many where we do the vibrations with our lips. When you do vocal warm ups, you have to remember, again, it's not just working the vocal cords. You want to exercise your respiratory muscles. You want to exercise your articulators, your lips, your cheeks, your tongue, because I could actually hum and change the shape of my vocal tract. This is another one, by changing where my tongue is, the tongue placement in my mouth. Sure. So if I make a humming noise and slide my tongue back and kind of pull the back of my tongue back and forward. So, right. And it's kind of like it's like you're making a siren and you go up the scale and down the scale and up the scale. And these exercises can go on for a half an hour.
Yeah.
They sound super silly, but there's a physiological reason why they're designed the way that they are designed to warm up the voice.
Yeah. And then how about just a quick cool down exercise? What's a good one to do at the end of the day?
The cool downs, I really like the steamer because now you just wanna heal everything that you did all day. So,
Right.
just even boiling that water and just kinda sitting, and I don't do it enough, but when I do it, I'll just say to my boys, teenage boys that are very loud, "I need to go in my room and, I have to do my thing," and you just go in and just sit there with it's just you just close your eyes and have that steam, 'cause you're breathing in and breathing out, and it's hitting those vocal cords.
Right.
I do wanna add one more thing about that, about the breathing. A lot of people will say, "Oh, well, they're a mouth breather." We always hear that phrase, "Well, they're a mouth breather." It's very important for us to try not to mouth breathe because mouth breathing dries up our throat.
Yeah.
And people would think a long time ago when I was new at all this, I'm like, "Well," and I'm picturing the anatomy. Well, if I inhale in my nose, it goes in my nose and down my throat and into my lungs. It has the same pattern. It goes to the same place. But the filters in the nose, we have turbinates in our nose, and those filters moisten the air that
Yeah.
goes in. So it's really important to breathe through our nose and not just depend on our mouth. And we do kind of breathe in and out of our mouth when we're talking all day because that's where the air goes in and out. We're not If we were breathing through our nose when we were speaking, we talk like this,
Yeah.
we'd be very hypernasal. And
Right.
there are people who are hypernasal who can't help it, and anatomically they speak that way. But that's why our throats are so dry too, is because we talk all day mouth breathing.
Yeah. Wow.
So that is my slideshow. I do have one last slide too,
Okay.
and I'll just offer that at the end here. I do work with people individually, so I thought I would share it here.
Perfect.
And because of everybody, what I decided to do was have a period of time where I knocked everything down quite a bit. So the session all the way to the right, like I said, I always meet with people at first and do a session that's no charge because I want people to feel like they're a good fit with me. And I also like to be able to say, yeah, this is something I can help you with, or no, this isn't something I could help you with. Or, get to that ENT right away or give any advice that I can in that short intake. And then I have the one session. So sometimes that one particular session can cover something and nip something right in the bud. So that's why I like to offer the one session. Sometimes it's just something really simple that someone might not have even realized. The intake session custom plan, I do follow that up with 4 calls, and normally that's 497. So I'm knocking that down to 249 until the 25th of April. And then I'm working on an ebook, and my ebook is all the videos with a lot of the theory that I shared with you today, the whole gamut of vocal warm-ups. So there'll be actual clickable links to be able to watch video of the vocal warm-ups, voice therapy techniques, and then laryngeal massage. And laryngeal massage is amazing, and that is the type of thing that we do for muscle tension dysphonia. So when the muscle tension, which is probably the most common reason why our voice changes, when muscle tension occurs, that laryngeal massage is key. And I will be real transparent here and let you know that I wouldn't have my voice right now like I do because before I came on, I was nervous. I was nervous to do this. I had the jitters, and I sat here and did my own laryngeal massage. And it's very particular. You have to put your fingers in a certain place, move everything a certain way, and that's going to be in here as well with
And
some bonuses. So
I have to say, doesn't Marina have a beautiful
oh,
voice? I mean, she has a great voice for her podcast. I was listening to it last
oh,
week as well, and I just thought she's got a great voice. So
thank you.
she I guess you practice what you preach. No pun
Thank you.
intended.
Thanks for saying that.
Yeah.
And I do have my email down there. If anybody, is interested in any of this, or if you have any questions, any questions, please email me or DM me. I'm happy to help. So,
Well, we do have one more question actually, and
okay.
it's a doozy. It's a long
Oh
one.
boy.
Again, it's from Yvonne,
Okay.
And so she's just, "Can you have a raspy or hoarse voice all the time and your throat isn't sore?" Her retired 91-year-old dad's doctor says his voice stays raspy due to age. So
Mhm.
we do see people's voices change over age. Is that because, I mean, obviously other muscles in an aging body get weak. Do your vocal cords then, I guess, get weak?
So it's a combination. Again, when our voice changes, it's not just our vocal cords. There are many other things that come into play, and this is called presbyphonia. It's normal after a certain age to actually have that older voice, and if you think about it, if you're on the phone with someone and you've never seen them before, you can kinda tell that it's an older person,
You
and
can.
that's from presbyphonia. So anything with presby before it. So hearing impairment due to aging is presbycusis. Presbyphagia is a swallowing impairment that naturally happens just due to aging. And yes, it's due to weakness, it's overall weakness. Is there something you can do about it? Yes. Yes. And it's just working, working again with a speech therapist. It's not easy because it's a different approach because you are working with anatomy that's aged. It's older. So you're trying to maybe do exercises where you're going to have starting new habits, and if that aged person really wants to do it and it's important to them, I do have some real whippersnapper older people that I work with, and they're amazing to me. I have 70-year-olds who act like 95-year-olds, and I have 95-year-olds who are like, yeah, I'm still practicing law, and I'm still, I mean, some of them are amazing, and it's important to them how they sound.
Yeah.
So, you can actually work on pitch. You can try to change their pitch to, like, finding their optimal pitch of what you can work with what you have, if that makes sense. So you can
So
improve
Yvonne,
it.
I guess, to your question, you might wanna schedule a 15-minute appointment with Marina and, give it a try. Just you and your
Yeah,
dad can join her. Yeah,
I would love that. Yeah,
that
it'd
would
be
be really
great.
good. Good.
You could
Well,
practice a few things in that 15 minutes.
I learned so much today. Um, yeah,
I'm so
so much. It's
glad.
really quite
Oh, good.
fascinating. I geek out on this stuff too, so I think that's what you and I get along.
I
We're
really geek out on this
both
stuff,
a
yeah.
little bit geeky in that way, but,
Yep.
it's fun to be geeky and learn more about, why things happen, but we
Yeah.
don't give our voice and really our anatomy from here up
Mhm.
enough attention, because I've had some hearing loss because of the tension in my shoulders. As I
Mhm.
get stressed, my shoulders come up, and the
Yeah.
muscles all tighten, 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 and then
Yeah.
it gets to little tiny muscles inside your ear that
Yes.
should dampen sound.
Yeah.
They quit working, so now I've got hearing
Wow.
loss. So, and it's all interconnected. Stress
Mhm.
stress is bad any way we slice
So
it.
bad. So
Yeah,
bad. Dis-ease, that's where disease came from, dis-ease. So we have to really do some self-care. We have to remember that, especially women. We
yeah,
don't do that enough.
we don't.
You know?
No. No, I'm terrible at it. Yeah, I
Me
look
too.
after everybody else first.
I know. It's
Yeah.
not enough hours in the day.
Nope, there aren't. But
I
I
appreciate you
found that
having me, Chris.
yeah, well, I'm so glad that you decided to come on. And what we'll do is in the comments, let's add your email address as well. So if anybody wants to contact you, they've got that. They can reach out to you either on Facebook or by your email.
Mhm.
Schedule that first 15 minutes and just dive in. See, it might be something quick, and it might
Yeah.
be, what I like that something you were telling me before is that um, you really give people a bespoke treatment plan depending on what their need is.
Yes.
And so that's really nice.
Yeah.
You're not just running through the gamut of exercises, same thing for everybody. It's really specialized for each person and what they need. So
Yeah.
um, I
Yeah.
highly recommend Marina. Reach on out, you guys, and look after your voices. She says it, voices. And I start joking. Ah, funny. Okay.
Yeah, what's important to a teacher might be different than what's important to a stay-at-home mom who wants to be able to read to her kids every night. You know,
Sure.
everybody's desires or something that really might be bothering them is like with anything in life, is is their own thing, you know? Um, but again, I wouldn't wanna see anybody suffer through it and think that there's nothing they can do about it, you know?
Yeah. Loads of options. You just need to do
Yep.
a little research and be willing to learn something new. So
Yeah.
great. Well, thanks again, Marina. That was really
You're
fun.
welcome.
Thank you, everyone, for joining us. Yvonne, thank you for your questions.
Yes,
It's been
thanks,
really
Yvonne.
interesting. And now you know where to find Marina. So, okay. Thanks again.
Thank you.
Happy Thursday, everybody.